Hey guys, Nurse Leslie here, the Beauty on Duty. Do you guys mind if I ask you a personal question? Okay, just between me and you, of course. Okay, when is the last time you cleaned your stethoscope? Okay, you don't have to answer that right now. Just go ahead and let it marinate, okay? And while you think about it, I'm going to show you what I do to clean my stethoscope. I use 70% isopropyl alcohol. I use cotton tipped applicators, paper towels. Okay, I have a double-headed stethoscope, which is for the diaphragm is for listening to high frequency sounds like heart sounds, and the bell is for listening to lung sounds. So mine actually screws off. The caps on the bell and diaphragm screw off, and I use my cotton tip applicator saturated in alcohol to clean around and inside the lid. Accumulation of dust can tend to make the acoustics of your instrument not work as well over time, so you definitely want to clean this out once or twice a week. I saturate the paper towel in alcohol, clean the rubber, okay, clean the metal, and then I take the earbuds off and clean inside those as well with alcohol saturated cotton tip applicators. In between patients, of course, you definitely want to clean the diaphragm as well as the bell of your stethoscope, okay, to break the chain of infection, to prevent nosocomial infections and transmitting bacteria and viruses. You definitely need to clean it between every patient. Sometimes people will wear their stethoscopes around their neck, which is not necessarily a bad idea, but it can be a safety hazard, because if you lean over your patient, it may clock them in the head, and that's not a good idea. It's just an accident waiting to happen. When I'm at my clinicals, I just kind of roll my stethoscope up and tuck it down into the pockets of my scrubs, and that works fine for me. They have little accessories that you can purchase that will hook onto your belt loop, and you can hang your stethoscope from that. That's totally up to you if you want to invest in that. It doesn't really cost a whole lot, maybe $13 to $15. And to maintain it, you don't want to just throw it into your school bag with your heavy nursing books, okay? You definitely want to treat this very kindly if you want it to work for you for a long time. Stethoscopes sometimes are not very cheap, so, increase the longevity of your stethoscope by taking good care of it. If you want to clean your stethoscope with the cavi wipes that they have sometimes at the healthcare facilities, that's a good idea too, but just make sure that the residue is not coming in contact with your skin, because that can definitely cause a skin reaction. Those disinfectant wipes are not for skin. They are for instruments, they're for surfaces, not for skin. So if you clean your stethoscope with that, make sure you're putting it down into your pocket or onto a belt hook. Okay, so I hope these tips really help you guys. If anybody out there has any tips that I could learn from, I'd be happy to hear them. If anybody has any questions, please let me know. Thank you so much for watching, and I'll see you on the next video. Bye-bye.